Thank you for joining us, everyone. I'm Nurse Danny here at Fresh Skin. This is Dr. Ryan. He is our board-certified doctor in anti-aging and integrative medicine. He also is a doctor of acupuncture and oriental medicine, and today we're going to talk about men's health.
All right.
The pro of men's health.
Yes.
The male of the men's health. Awesome.
Let's talk. Ask away.
Yeah, so
figure it out.
hormones, right? They play a role in everybody, every male, female. And last month we focused a lot on women, and I think that women tend to get the brunt of it, right? It's always like, oh, hormonal, that's women. But men definitely have the same fluxes up and down as well, and have their version of a male menopause, right?
Absolutely. Men actually even have monthly cycles. We just don't.
I knew it.
I think we're less obvious about it, and and we obviously have, we don't cycle like a menstrual cycle.
But I think
so
too,
we don't
like
have
that.
like that same every month we're gonna have
True.
at 3 weeks we're gonna have this premenstrual type syndrome, and we don't go through that, but we definitely go through the peaks and valleys of energy levels, fatigue, bloating.
Yes.
That's all real stuff.
Yes. You know what I think happens is it gets swept under to thinking that, oh, it's just really stressful at work right now. Oh, the kid's schedule is so busy right now, or I'm really trying to advance my career right now, and it seems to just tend to happen monthly, and it's like, well, why is it so why is this happening so frequently? And it may be that all of these things are happening, but these influxes of hormones are changing your ability to cope or deal with these changes in your body and the stressors that are on the external as well.
Well, I mean, let's be real. With guys, we'd like to think, oh, it's his stressful job, or it's his stressful life, and he's running around and doing all this stuff. But there are men with non-stressful jobs or very exciting lives. We all still go through the same hormonal processes, and much of it is individually and genetic based. A lot of it is lifestyle based. A lot of it is situational. We think, like you were touching on menopause. Menopause is kind of for the most part, it's going to be a genetic, almost pre-programmed time of when a woman's going to go through menopause.
Right.
You're going to produce less hormones. You're going to start experiencing the symptoms associated with aging and altered hormone levels.
Right.
Men will have that same thing. Men can trigger andropause, male menopause-like symptoms.
Andropause. That's such a good term to learn. I think being part of this practice, that's something that I've learned, is that there's a term for it. There is a time that happens. So andropause.
Absolutely. But we can trigger those things early. We can trigger them by weight gain, by a sedentary lifestyle, by increasing belly fat. All of those things will alter our hormones.
Right.
We also can trigger changes in hormones just from different times of our lives, like if your significant other is pregnant, you bring a baby into the house.
Yes.
Even if you bring like a puppy into the house, your hormones change because you become a little bit more involved in caring for something. So literally testosterone drops a little bit, estrogen raises a little bit, and you can test it, you can prove it. And
so fascinating. That's so fascinating. I think that's actually something, at least in my practice, I have found that there is this overarching, subtle complaint that we had the baby, but our relationship is no longer the same.
Right.
And everybody always says, well, it's the stress of having the baby. And yes, that's a component, but nobody ever thinks to look at, well, there's, this change in, what's going on in his body and what's going on in my body, and how is that chemistry still going to stay the same? How do we address those things?
Well, you've got two things. You have the obvious changes in the, if it's a male-female couple, you have the obvious changes in the woman, their body, their hormones, whatever. In the male, there's a certain difference in feeling of responsibility.
Sure.
Now these are generalizations, but it's pretty legitimate in what we've seen. But there's also a lot of kind of being a homebody that is different than maybe it used to be.
Sure.
You're ordering in more, you're less active,
Sure.
You're spending a lot of different kind of time. And so if you're not exerting yourself at the level that you were before, especially for a guy where muscle mass is so important at maintaining in order to not just maintain the lean body mass, but to maintain proper hormone levels.
Right.
And it becomes a cycle. If you're less active.
So this cascade event of like, this beautiful thing is brought into our lives, we're trying to figure out our new us.
Right.
But that also comes with, okay, well, how do I change that to maintain this muscle mass? How do I change that to maintain the appropriate amount of like libido and satisfaction sexually, in their career, in their family, and everything, right?
Well, the first thing to go, which is so fascinating, even though the first thing to go for the most part is going to be motivation.
Okay.
Even though you might be motivated at work,
Right.
and you might be motivated to have certain types of experiences, the first complaint that we hear is, I'm less interested.
Okay.
And it's whether they're less interested, their libido is dropped,
Okay.
they're less interested in getting to the gym, they're less interested in going out with their friends.
Right.
There's something that happens where they're just less interested. And that alters that relationship, because what you may have fallen for
Sure.
was the excitement
Yes.
and the interest in the person who was always ready to go regardless.
Sure. Absolutely.
And all of a sudden, they're not.
But that's a normal thing, right? So
Right.
that's the thing, is that I think people look at it and say, well, you've changed. Yes, I've changed, but this is a normal process. So how do we go from knowing these normals and these things that are going to inevitably happen?
Mm-hmm.
How do we then take that next step and saying, okay, well, what do I need to do for me? How do we make it more individualized for that person?
Some of it, you want to look at the reasons. The other
Okay.
thing, but first I would say you want to look at a pattern. You want to look at, all right, honestly, I don't care if you're 45 or 65 or 75, you want to look at what was it like at 25.
Right.
Because men's testosterone is going to start dropping essentially after age 25.
Can you believe that? Let's say that one more time, right? Because I think that we just wait and wait and wait until we're at a point of, I'll just say like erectile dysfunction or after having a family, and then we say, now my testosterone is going. So, to repeat that, when was it again?
After age 25,
What?
things start to change.
Yes.
There's a lot of reasons. Some of it is, especially in the US, we have this American lifestyle that, is all about work, 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 put in as many hours as you can, strive, strive, strive. So age 25 to 40, these are working years where you are continually working, but you're also burning the candle at the other end.
Yes.
You're also
Yes.
out and about, you're either partying, you're building family, you're doing something that is not just going to work and going home,
Right.
or maybe going to work, going to the gym, but maybe it's you're going to work, going to the gym, going home, going out with your friends, you're doing all of this stuff, and you don't notice that
These
decline
small changes,
that's really
yeah.
happening. But it's between about 1% and 5%, every year to 5 years. So if you start going 15 years out and you have something like 15 to 50% reduction in testosterone production, but you weren't paying attention,
Right.
all of a sudden you're like, it happened all of a sudden. It didn't. It took a long time.
Okay.
And during that time, if you start developing some belly fat, and that which harbors hormone,
Right.
reduces your testosterone production, increases risks of things like insulin resistance and other metabolic syndromes, all of that comes full circle, starts reducing interest, reducing motivation, reducing libido,
It's
reducing...
like this vicious cycle.
Yeah. Oh yeah.
So when we have someone as a patient coming into us, I know that we get a lot of referrals from wives, from friends, from male clients, another male client, which is awesome. But to someone that doesn't know how to get this started, what kind of symptoms are they coming in with, actual symptoms, and then what are we doing? What's our steps?
So we'll hear fatigue, low libido, reduced morning erection, that's a huge one, less sexual satisfaction in general, reduced response in the gym.
Okay.
They're like, I do the same stuff I used to do, I used to eat the same
It's
way I
just
used to go work out,
doing
I'm just
it.
not getting that
Okay.
response I used to get. Those are the first things that a guy will come in and say.
Okay.
If it's a woman referring them, it's a lot of things that he's not going to tell you this. He's not going to tell you.
He's not going to tell you X, Y, and Z.
Right. But at the same time, a lot of guys aren't going to seek out help. They're not generally going to talk to their friends about it, so they're never really going to get a good referral.
Okay.
They sometimes just need a push, or sometimes they're scrolling on social media or internet or commercial.
Wow,
now
this really fits.
There's 100 commercials for low T on every football or basketball game you watch. So golf, especially, there's it's loaded with them. The thing is, it's a real thing. It's not like we just have low testosterone as a new diagnosis. It's just been, now it's okay to talk about. low testosterone has been a big deal forever. We also take medicines. We have changes in our lifestyle now that kind of almost reinforce the body's reduction in testosterone production. So.
And can we talk about too, like the age group of males too? Like we see
totally.
even younger groups of men as young as 20, 25 that are coming with hormonal issues.
Yeah.
To
and it's
men.
not, and sometimes it's not just hormones, right? Sometimes it's nutrient deficiencies. A lot of times patients will say, "Oh, I do take a multivitamin." Okay, but is that enough, or is that even correct? I do take supplements. Are those even the right ones for you?
The nutrient deficiencies are a big deal because there are very specific nutrients that can help encourage testosterone production.
Okay.
Now, you're not going to replace testosterone with a quote-unquote supplement.
Sure.
You generally need to actually replace testosterone with testosterone, but you can encourage your body to produce it, whether it's with supplements or medication that are, many of which are FDA approved and been on the market a long time.
Right.
For the most part, though, if someone's coming in with complaints that mimic andropause or low testosterone, they can also mimic metabolic disease.
Right.
So, and
Absolutely.
nutrient deficiencies. And so we'd want to know, we would basically have first we'd have a consult, someone would come in, they kind of spill their guts, tell me everything that's going on. Some things that they're not comfortable talking about, we'd identify through surveys and some other.
As they get comfortable, those things kind of come up. But is there like an age range though that we're seeing? Like what's a common?
Honestly, over the last couple of years, we have had the early 20s, which has been, pretty fascinating. But they were right. Every single one that came in and said, I think I have all of these symptoms that I saw on that commercial. They were right. They were dead on right. They were at the lowest end of the normal spectrum.
Right.
And normal doesn't mean enough because we're talking about hundreds of points. We're not talking about.
And we're talking about hormones. We're talking about
Right. We're talking about a really big range.
Yeah.
So.
And many different things, not just testosterone, right? Because we have to remember that it's not just the one thing that fixes all. There's all these different components, which makes what we do really nice, and individualized to our clients and their needs, right? You come in and you say you have hair loss. We're going to identify it. Is there something underlying that's causing this? Are your hormones optimized? And then what services do we offer, or what kind of things are available in order to optimize that growth and optimize your health? It's a very collaborative, very comprehensive approach in everything that we do, right? When we take the integrative medicine portion of it.
Yeah, I think you have to, because it's not as simple as I have this one thing, can you fix it, or can you remove it? Totally. It's not that kind of, we're not that kind of practice, but it's not that kind of complaint. It's normally almost energetic. So you have to figure out, all right, well, what's changed, what was baseline? We never know. People generally don't come in when they feel their best. You would think a 23, 25-year-old person would come in
and that should be
that would
be
an awesome baseline. And it's not always like that. So our sweet spot, I would say in age, it's a wide sweet spot. That 35 to 65 is when we can really make a huge difference in the way someone feels when it comes to hormones.
Okay. And just getting a sneak peek, right? Like maybe you do feel great. Maybe you don't feel like you have any of these crazy symptoms or outliers or something that's making you question, why is this so much more difficult for me now?
Right.
Maybe you come in and just learn and figure out, how do I continue to feel this way? How do I continue to keep this and be more preventative and proactive as opposed to corrective? And I mean, we see people for both reasons, but definitely taking advantage of that early.
Yeah.
Earlier on,
Absolutely. The earlier we catch something or we identify where that change occurred or when that change occurred, the more of an impact that we can make.
Right. Absolutely.
Not just to kind of correct that imbalance, but also to prevent future issues. I
think this is super exciting. I think that being able to speak on the male aspect of things and having Dr. Ryan, who has, that ability to say, okay, I'm looking at this from a personal level, I'm looking at this from a clinical level, and is able to relate or, identify these things much more comfortably. We spend a lot of time talking about women. It's been a very, women-dominated industry for a long time.
Definitely.
And it's beautiful and it's so fantastic that we are really able to engage the male clientele. So if anybody, thank you so much everyone for joining us today and watching. If anybody has any questions, if there's something that we didn't touch on, if there's something that you're saying, I wonder if this correlates. I wonder if this is, a result of hormone deficiencies, nutrient deficiencies, whatever that may be, please feel free to reach out to us, because I think this is such an undereducated or under-discussed in public education topic. And I think there's so much room for growth and so much room for you to learn just about you yourself.
Learn and start to feel better.
Yeah, totally.
Yeah.
All right, one last thing. Make sure you follow us on social. So we have Facebook, we have Instagram, YouTube. Head over to our website, subscribe for our newsletters. Dr. Ryan puts together awesome monthly newsletters with all of our wellness topics. So you'll learn tons from that, and then always call us, right?
Yeah.
Easiest person to talk to. You'll learn so much about yourself.
myfreshskin.com.
Thanks,
Bye,
guys.
everybody. Thanks for coming.